Welcome! Today, we're diving into the world of acid reflux, a condition that affects millions of people worldwide. If you've ever felt a burning sensation in your chest after eating, you're not alone. Acid reflux occurs when stomach acid flows back up into the esophagus, causing discomfort and a range of symptoms. Understanding these symptoms is the first step toward managing and treating acid reflux effectively. In this video, we'll break down the most common signs to watch for, helping you recognize acid reflux early and seek the right care. Let's get started by exploring what acid reflux really feels like. Acid reflux, also known as gastroesophageal reflux disease or GERD when it's chronic, happens when the lower esophageal sphincter doesn't close properly. This allows stomach acid to escape into the esophagus, leading to irritation and discomfort. The esophagus isn't designed to handle acid, so even small amounts can cause noticeable symptoms. While occasional reflux is common, frequent episodes may indicate a more serious problem. Recognizing the symptoms early can help prevent complications and improve your quality of life. Next, let's look at the hallmark symptom that most people experience. The most well-known symptom of acid reflux is heartburn. Despite its name, heartburn has nothing to do with the heart. It's a burning sensation that starts in the chest and may move up toward the throat. This discomfort often occurs after eating, especially if you've had a large meal or consumed spicy, fatty, or acidic foods. Heartburn can last from a few minutes to several hours and is often worse when lying down or bending over. If you frequently experience this burning feeling, it could be a sign of acid reflux. Let's explore some other symptoms you might notice. Another common symptom is regurgitation. This is when you feel a sour or bitter-tasting acid backing up into your throat or mouth. Unlike vomiting, regurgitation doesn't involve forceful expulsion of stomach contents. Instead, it's a passive sensation where food or liquid seems to come back up, often leaving an unpleasant taste. This can happen after meals or when bending over. Regurgitation is a clear sign that stomach acid is moving in the wrong direction. If you notice this happening regularly, it's important to pay attention, as it may indicate ongoing acid reflux. Difficulty swallowing, also known as dysphagia, is another symptom that can be associated with acid reflux. People may feel like food is stuck in their throat or chest, or experience pain when swallowing. This happens because repeated exposure to stomach acid can irritate and narrow the esophagus, making it harder for food to pass through. If you find yourself needing to drink water to help food go down, or if swallowing becomes painful, it's a sign to take acid reflux seriously. Persistent swallowing problems should always be evaluated by a healthcare provider. A persistent cough that doesn't seem to go away can also be linked to acid reflux. Stomach acid that reaches the throat can irritate the lining, triggering a cough reflex. This cough is often dry and may be worse at night or after eating. Unlike a cough from a cold, it doesn't usually come with other respiratory symptoms like congestion or fever. If you have a chronic cough with no obvious cause, acid reflux could be the culprit. Let's look at another symptom that often surprises people: hoarseness. Acid reflux can also affect your voice. When acid irritates the vocal cords, it can cause hoarseness or a raspy voice, especially in the morning. Some people notice their voice sounds different or that they need to clear their throat frequently. This happens because the acid inflames the tissues in the throat and larynx. If you're waking up with a hoarse voice or experiencing unexplained changes in your speech, acid reflux might be to blame. Next, we'll discuss another symptom that can be mistaken for something else: a sore throat. A sore throat that lingers without other signs of infection can be a symptom of acid reflux. The acid that travels up from the stomach can irritate the lining of the throat, causing pain or a scratchy feeling. Unlike a sore throat from a cold, this discomfort often doesn't come with a runny nose or fever. It may be worse in the morning or after meals. If you notice a persistent sore throat, especially when combined with other reflux symptoms, it's worth considering acid reflux as a possible cause. Chest pain is a symptom that can be alarming. While heartburn is a type of chest pain, acid reflux can sometimes cause discomfort that feels similar to a heart attack. This pain is usually burning or sharp and may worsen after eating or when lying down. It's important to note that chest pain should never be ignored. If you're unsure whether your pain is due to acid reflux or something more serious, seek medical attention immediately. Next, let's talk about another symptom that can affect your sleep: nighttime reflux. Acid reflux often gets worse at night. Lying down makes it easier for stomach acid to flow back into the esophagus. This can lead to heartburn, coughing, or even choking sensations that wake you up. Some people also experience a sour taste in their mouth or excessive saliva production at night. Poor sleep due to reflux can leave you feeling tired and irritable during the day. If your symptoms are worse at night, try elevating your head while sleeping and avoid eating close to bedtime. Bad breath, or halitosis, is another symptom that can be linked to acid reflux. When acid and partially digested food come back up into the throat and mouth, they can create an unpleasant odor. This is especially noticeable in the morning or after meals. Brushing your teeth may help temporarily, but if bad breath persists despite good oral hygiene, acid reflux could be the underlying cause. Let's move on to a symptom that can affect your appetite: nausea. Some people with acid reflux experience nausea, which can sometimes lead to vomiting. This is more common in severe cases or when reflux episodes are frequent. Nausea may occur after eating or when lying down, and it can make you lose your appetite. If you notice that you often feel queasy or actually vomit after meals, it's important to mention this to your doctor. Persistent nausea and vomiting can lead to dehydration and other complications if not addressed. Bloating and frequent burping are also symptoms that can accompany acid reflux. When acid irritates the stomach and esophagus, it can cause excess gas production, leading to a feeling of fullness or pressure in the abdomen. Burping is the body's way of releasing this gas, but if it happens often, it may be a sign of ongoing reflux. These symptoms can be uncomfortable and sometimes embarrassing, but they're important clues that your digestive system isn't working as smoothly as it should. Excessive saliva production, also known as water brash, can be a lesser-known symptom of acid reflux. When acid irritates the esophagus, the body may respond by producing more saliva to help neutralize it. This can lead to a sudden rush of saliva in the mouth, especially after eating or when lying down. While it's not harmful, it can be uncomfortable and may be accompanied by a sour taste. If you notice this happening frequently, it could be another sign of acid reflux. A sore throat that doesn't go away, even after treating it with typical remedies, can be a sign of acid reflux. The constant exposure to stomach acid can cause ongoing irritation and inflammation in the throat. This may be accompanied by a feeling of a lump in the throat or the need to clear your throat often. If your sore throat persists for weeks and isn't linked to a cold or allergies, acid reflux could be the underlying cause. Some people with acid reflux report ear pain or a feeling of fullness in the ears. This happens because the nerves in the throat and ears are closely connected. When acid irritates the throat, it can sometimes cause referred pain to the ears. While not as common as other symptoms, ear discomfort can still be a clue, especially if it occurs alongside more typical signs of reflux. Acid reflux can make asthma symptoms worse. When stomach acid enters the airways, it can trigger bronchospasm and inflammation, leading to coughing, wheezing, and shortness of breath. People with asthma may notice their symptoms are harder to control or that they need to use their inhaler more often. If you have asthma and notice a sudden change in your symptoms, acid reflux could be a contributing factor. Chronic laryngitis, or ongoing inflammation of the voice box, can be caused by acid reflux. This leads to symptoms like hoarseness, loss of voice, or a constant need to clear your throat. The acid irritates the delicate tissues of the larynx, making it difficult to speak or sing. If you're experiencing these symptoms without another clear cause, acid reflux may be the reason. Stomach acid is strong enough to erode tooth enamel. People with frequent acid reflux may notice increased tooth sensitivity, cavities, or visible enamel loss. This happens because acid that reaches the mouth can wear away the protective layer on your teeth. Good dental hygiene is important, but if you're experiencing unexplained dental problems, acid reflux could be a hidden cause. Globus sensation is the feeling of having a lump or something stuck in your throat, even when nothing is there. This can be caused by irritation from acid reflux. It's not usually painful, but it can be uncomfortable and persistent. If you notice this sensation, especially with other reflux symptoms, it's worth mentioning to your doctor. Frequent hiccups can sometimes be a symptom of acid reflux. When acid irritates the diaphragm or the nerves that control it, it can trigger hiccups. While occasional hiccups are normal, persistent or frequent hiccups may be a sign of an underlying issue, like acid reflux. If you notice this happening often, it's worth discussing with your healthcare provider. Wheezing, or a high-pitched whistling sound when breathing, can be another symptom of acid reflux. This happens when acid irritates the airways, causing them to narrow. Wheezing is more common in people with asthma, but it can also occur in those without respiratory conditions. If you notice new or worsening wheezing, especially at night, acid reflux could be a factor. Some people with acid reflux experience a choking sensation, especially at night. This can happen if acid or food backs up into the throat and causes sudden discomfort or difficulty breathing. It can be frightening, but it's usually brief. If you wake up gasping or choking, it's important to mention this to your doctor, as it may indicate severe reflux. A sensation that food is sticking in the chest or throat can be a sign of acid reflux. This is related to difficulty swallowing and can be uncomfortable or even painful. It may have constant more often with dry or solid foods. If you notice this symptom, especially if it's new or worsening, it's important to get it checked out. Constantly needing to clear your throat can be a subtle symptom of acid reflux. The irritation caused by acid can make you feel like there's mucus or something in your throat, even when there isn't. This can be bothersome and maybe worse after eating or when lying down. If you find yourself clearing your throat often, acid reflux could be the reason. In some cases, acid reflux can lead to unintentional weight loss. This may happen if eating becomes uncomfortable or if nausea and vomiting are frequent. If you notice you're losing weight without trying, especially along with other reflux symptoms, it's important to see a healthcare provider to rule out more serious conditions. Loss of appetite can be a result of ongoing acid reflux. If eating regularly leads to discomfort, heartburn, or nausea, you may start to avoid meals. Over time, this can affect your nutrition and energy levels. If you notice you're eating less because of digestive symptoms, it's important to address the underlying cause. Some people with acid reflux feel full after eating only a small amount of food. This early satiety can be frustrating and may lead to inadequate nutrition. It's often caused by irritation or inflammation in the stomach and esophagus. If you consistently feel full quickly, especially with other reflux symptoms, it's worth discussing with your doctor. Nasal congestion or postnasal drip can sometimes be linked to acid reflux. When acid irritates the throat and nasal passages, it can cause increased mucus production. This may lead to a stuffy nose or the feeling of mucus dripping down the back of your throat. If you have persistent congestion without allergies or a cold, acid reflux could be a factor. Chronic sinus problems, such as sinusitis or frequent sinus infections, can sometimes be aggravated by acid reflux. Acid that reaches the upper throat and nasal passages can irritate the sinuses, leading to inflammation and discomfort. If you have ongoing sinus issues that don't respond to typical treatments, acid reflux may be playing a role. Living with acid reflux can be exhausting. Poor sleep due to nighttime symptoms, combined with the discomfort of daily symptoms, can lead to chronic fatigue. If you're feeling tired all the time and can't pinpoint a reason, acid reflux could be affecting your rest and energy levels. Some people with acid reflux notice they're thirstier than usual. This can be due to mouth dryness from breathing through the mouth at night or from the body's attempt to neutralize acid. If you're drinking more water than usual, especially at night, it could be related to reflux symptoms. Frequent sighing or the need to take deep breaths can sometimes be linked to acid reflux. Discomfort in the chest or throat may make you feel like you need to catch your breath. While this can also be related to anxiety, it's worth considering reflux if it happens alongside other digestive symptoms. Living with chronic acid reflux can take a toll on your mental health. The discomfort, sleep disturbances, and worry about symptoms can all contribute to feelings of anxiety. If you notice increased anxiety along with physical symptoms, addressing your reflux may help improve your overall well-being. A burning sensation in the throat, sometimes called acid throat, is a direct result of acid irritating the delicate tissues. This can be painful and may make swallowing uncomfortable. If you notice a burning feeling that isn't relieved by drinking water, acid reflux could be the cause. Some people with acid reflux report a metallic or bitter taste in their mouth. This is caused by stomach acid and partially digested food reaching the mouth. If you notice this taste, especially after eating or at night, it could be another sign of reflux. Nausea that doesn't go away, even when you haven't eaten, can be a sign of acid reflux. This ongoing queasiness can make daily activities difficult and may lead to decreased appetite or weight loss. If you're experiencing persistent nausea, it's important to get evaluated for possible reflux or other digestive issues. Feeling bloated or overly full after eating is a common complaint among people with acid reflux. This can be due to delayed stomach emptying or increased gas production. If you regularly feel uncomfortable after meals, it could be a sign that acid reflux is affecting your digestion. Repeated throat infections or tonsillitis can sometimes be linked to acid reflux. The constant irritation from acid can make the throat more susceptible to infections. If you have frequent sore throats or tonsil problems, it's worth considering whether reflux could be a contributing factor. Children with acid reflux may show different symptoms than adults. A chronic cough, especially at night, can be a sign of reflux in kids. Other symptoms may include vomiting, refusal to eat, or poor weight gain. If your child has a persistent cough or feeding difficulties, acid reflux could be the cause. Not everyone with acid reflux experiences heartburn. Silent reflux, or laryngopharyngeal reflux, occurs when acid reaches the throat without causing obvious burning. Symptoms may include hoarseness, chronic cough, or a lump sensation in the throat. Because it's less obvious, silent reflux can be harder to diagnose. If left untreated, acid reflux can lead to complications such as esophagitis, strictures, or even Barrett's esophagus, a condition that increases the risk of esophageal cancer. Recognizing and managing symptoms early is key to preventing these serious outcomes. If you have frequent or severe symptoms, it's important to seek medical advice. While occasional acid reflux is common, frequent or severe symptoms should not be ignored. If you experience chest pain, difficulty swallowing, unexplained weight loss, or vomiting blood, seek medical attention right away. Early diagnosis and treatment can help prevent complications and improve your quality of life. Managing acid reflux often involves lifestyle changes, such as avoiding trigger foods, eating smaller meals, and not lying down after eating. Medications may also help reduce acid production. If you're struggling with symptoms, talk to your doctor about the best treatment plan for you. Taking action early can help you feel better and prevent future problems. To sum up, acid reflux can cause a wide range of symptoms, from classic heartburn to less obvious signs like chronic cough or dental problems. Recognizing these symptoms early is the first step toward effective management. If you suspect you have acid reflux, don't hesitate to seek help. With the right approach, you can reduce discomfort and protect your long-term health. Thanks for watching, and take care of your digestive health.